I'm Dr. Erin Elliott.
And I'm Jason Tierney.
I'm a dentist.
And I'm a dilettante. And we're going to talk about sleep matters because
sleep matters.
Dr. Erin Elliott, we're here in Scottsdale still.
I don't ever want to go.
Yeah, this might be a new home, huh?
No. Second home, it's fine. Second home.
Yeah. We're happy to call you an Arizonan, even if it's part. I mean, most Arizonans are part-time.
Yeah. It's unbelievable. We have so many snowbirds. And I'm like, take me with you. But then I realized I actually like the winter. I just like coming down here for a break.
Sure. And
unless I can find a dentist that'll work down here in the summer and up there in the winter, and then I just become, trade with them.
Well, and I like the winter, but only as a break from the perpetual summer here. So at some point, maybe Licia and me and you and Tom will have to do a house swap.
Yes.
Yeah.
I don't know. You'll fall in love with it. You keep saying you're going to come visit, but that hasn't happened.
We'll make it happen. Yeah, I'm eager to get up there, so we'll make that happen. But before we just banter the hour away, let's welcome today's guest, Dr. Craig Harder. Thanks for joining us here on Sleep Matters.
Thank you, Jason and Erin. And Jason, if you get to her house, you'll be pleased to have your own urinal to use, as the men have.
Fun fact.
Cool thing, but well, thanks
that
for
might be. Erin, you just got so much cooler in my book, and we're gonna have to talk about this because this is a conversation that Licia and I have, and it's not the one you're thinking about, seats up or down or anything like that. But we'll talk about this later. But thank you for that tidbit,
yes,
Dr. Harder.
They've got
now he'll actually come visit. Thanks.
Just figured that little bit of prodding would get you there. So
that's all it took was a urinal. I'm a simple man. I
knew I liked you, Jason. So we're right on the same page with that. It's pretty easy.
Yeah, as long as we're not at the same urinal, we're good.
Oh yeah, you can't talk when you're in there. That's
I'm going to introduce my friend Craig here because I have known Craig for 15 plus years. There was back before Facebook and Instagram and all of that, there was a group of dentists that knew each other on Google Groups. It was called ACE at the time.
Oh, yeah.
And I was introduced when I discovered that dentists could be part of sleep. I set off on a mission to learn more, and that's where I met Dr. Kent Smith. And when I went to the course, all these people knew each other, and I was like, how do you guys all know each other? And they're like, well, we actually don't. We just met, but we know each other from this Google group called ACE. And so I joined. And Craig and I were the only Pacific Northwesterners, so we kind of had a connection there. Craig practices in Moses Lake, Washington, which is about 3 hours east.
Yeah, like 125 miles.
Yeah,
2 hours. Really?
2 hours. And he likes to fish and stuff, so he stops at my office periodically, even stopped at my house. And so it's really nice to have a neighbor in the dental community. But Craig, I'm gonna have you share just a little bit of who you are and why in the heck would we even have you on here?
Well, thanks, and hopefully I won't get too crazy on giving my own spiel here. But yeah, I'm a 1995 Creighton grad. Grew up in Spokane, Washington, so pretty close to where Erin's at now. And Erin and I also became friends because of the Creighton connection. That helped out as well.
Mhm.
But, in 1996, bought a practice in Moses Lake. Been here roughly 30 years then, just short. And I was one of those lucky guys that was kind of raised in dentistry during the cosmetic boom. And so I did a lot of veneers and extensive aesthetic restorative stuff early on in my career, and slowly started getting some interest in sleep medicine from the folks on that email list that Erin was talking about, and kind of getting shamed into the idea that, hey, you weren't doing it yet, you better get busy. But then we had a little incident in our family. I shouldn't call it an incident, but my daughter was diagnosed with cystic fibrosis that I sat at her hospital bed one day watching her, and she was breathing about 45 to 50 breaths per minute. And I knew that wasn't right as I looked it up, and it should be about 16 instead. And so it kind of started me on the rabbit hole of breathing and sleep apnea and all of that. And so that kind of started staying in my head for all these years. And slowly I tried to incorporate it. I was one of those common dentists that we all know that half-assed trying to get into doing sleep medicine. And as we know, you got to get in full ass, and I was more like quarter ass, so it didn't work out. But yeah, so I stayed in dentistry, doing all my cosmetic work and restorative stuff, and then started having some little things happen. Had a little twitch in my hand as I was driving down the road one day that I noticed. And if you've seen the Michael J. Fox movie, Still, his documentary about himself, he talks about the first moment when he knew he had something going on was that he felt a butterfly twitching on his hand was what he thought it was. And I'm look back now and that's exactly how I felt. I'm looking at my thumb on the steering wheel, it's twitching and I don't know why, but when I focused really hard on it, it would stop and then I'd stop and it would start going again. And slowly that turned into a bigger tremor to where back in 2022, I was finally diagnosed with essential tremors. And the medications worked really good for that for a while. Essential tremors are the ones that when you start to do something, that's when the tremor happens. It's an action tremor, as they call it. I got put on medication that worked really well for a while, and then slowly that stopped working. And I started doing more research on what was happening, and I knew what it was without getting a diagnosis yet that I was actually having Parkinson's disease instead. So I got on the ball and knew that I had probably 3 to 5 years to get this thing figured out before I wouldn't be able to practice anymore. And so I started that process of trying to find a buyer. Being in a smaller community is in central Washington that doesn't have a big draw other than outdoors. It's a little difficult to get a DSO to want to buy you. They want that bigger practice or one that's in the big city. So we had a few of those fall through, and so I started thinking, okay, what can I do to get away from using my hand skills all the time? Started doing more dentures and ortho, and started getting back into sleep again, which was a good move for me because it was turning my brain around and getting it off that thoughts of I'm not going to be able to do this, I can't do this anymore. We got that direction, and yeah, finally in 2024, I was diagnosed with Parkinson's disease, and we started on that road now. So it's been a push. There's a lot of things that happen when you start getting those diagnoses, and when you realize that you're no longer going to be able to work in the field that you've come to enjoy and has become your identity.
Mm.
That's where we stand now. Is that Parkinson's changed everything, and it put me in on a path to start talking with some of these people that Erin and I knew back in the day. And I used to go on a Texas tour and see the dentists down there like Kent Smith and Bruce Baird, Marvin Berlin, Rick Coker, these guys that were
Yeah.
became mentors over time. So I started reaching back out to them, and they were offering kind of help of, oh, these are some ideas. But Kent was really the one who came through and said, hey, you need to transition your practice. You need to turn it into a dental sleep medicine practice. And if you can't do that, then come work for me. So I joined Kent's team back in November of 2024, and I started doing telemedicine for him, reading sleep studies and going over it with patients, kind of trying to put it into the layman's terms, what's going on with them, and helping to recommend treatment after they're educated on their conditions.
Mhm.
And that was way more work than I was ready for. Heck, I was working 3 days a week and being a dentist, and then I got 2 more days, and all of a sudden I'm working 45 hours a week when I really didn't wanna work that hard. But luckily, coming January of this year, I was able to sell my practice, and so now I work for Kent 3 days a week doing that, and that's plenty full time because it's gives me the time to do the things I like fishing and traveling to Montana and stopping at Erin's office on the way through.
Yeah. Yeah.
So that's my intro. A lot of things to unpack, I guess, with that, but a lot of things.
There's a lot going on there. Let's if we can, would you mind sharing just a little more about you made the comment about losing something that had really become part of your identity.
Yeah.
Can you talk about that? How have you how have you wrestled with that? How have you danced with that? And kind of where are you with that today?
Yeah, that's a great question, and I'll back up a little bit. On that day in June of 2024, when I finally was able to get in to see the neurologist, I knew it was coming, but I didn't want to allow that to really take over yet.
Mm,
The neurologist closest one is an hour away, so I drove there. My wife wanted to go, and I said, "Nope, nope, this is no big deal. I'm just going to go check and see. They won't give me any idea of what's going on." Got there, got the diagnosis immediately. The neurologist knew what was going on just watching me walk, watching me try and write as my hand. I used to have gorgeous handwriting, and now I've got a scribble look. So he told me, and then I went out to my car and I sat there and cried for an hour, sitting in the parking lot, wishing I had brought my wife with me.
mm,
All those things then all of a sudden hit me that it doesn't matter what stage my Parkinson's was in. I'm in early stage. It's not bad at all right now. Still isn't. But to me, at that moment in time, my world was ending, and that was a big hit. And to try and go back to practice is tough for a while. That crushing feeling of the stress of all of it on top of it. I kind of figured there's about 3 stages that I went through. First one, and I think everybody who kind of goes through this process after they've been told they've got a disability or that they're not going to be able to practice any longer. The first one was I was selfish as heck. All I could think about was what it's done to me, what my identity is going to be after this. All I could think was now I've gone from the well-known dentist in town that helped out the community to I'm the person that people are going to stare at and wonder what's happened to them as I have the shakes sitting in a room trying to drink my coffee, whatever. Um, it was all, how am I going to deal with the pain? What's going to happen? All those things. The second thing that happens then is you panic like crazy over what this is gonna do to your family and to your friends and to your, teammates, that work with you. All of a sudden, I've got, 5 or 6 patients or people that work for me that may not have a job soon. How am I gonna help them? What's gonna go on there? And, every family has some, needs of taking care of their kids still and all those things that, I've got a daughter that's making her way getting her master's degree, but she still needs help financially,
mhm,
all those things. My wife, she's been the rock for me as a business manager along the way, but all of a sudden, we don't have a business that's gonna be going. So all that stuff really kinda cripples your thoughts.
mhm,
And then the third thing happens, and that's when you finally realize you can't change this, so you better attack it, and you better dig in, and that's what really helped me a lot was to finally say, "Get busy. You're not dead yet. You're you're still able to practice, you're still able to work, and you better get things figured out now ahead of time." So, yeah, that's when I really started focusing on some of the other procedures, in my practice. I really got active trying to sell the practice. We started, getting busy and talking with our team of professionals, our accountant, actually even my doctor was added in a little bit, our lawyers, all those folks that will help you, that have helped you along the way with setting up your will, setting up your investments. We needed to actually now sit down and plan on it because I hadn't planned to retire for at least 10 more years. And
mm,
while we really did well starting young with our investments, when you have that goal 10 years out, you're not there yet. So we had to find a way to supplement the income along that time too.
mhm,
But
mhm,
yeah, all that stress is pretty crushing. And while I didn't seek any therapy or any help, I was fortunate to have good people around me that helped me. But I would highly encourage anybody to reach out to mental health professionals along that way because that stress is quietly a very crushing thing.
Especially if you're just trying to internalize it
Yeah.
and deal with it and not have anyone feel sorry for you or
Yeah. You know any dentists that do that? Yeah. It
yeah,
seems to be
no, none.
all of us who are at least private practice owners, that, shoot, um, your business is your baby.
Mm,
I took over the practice, but I grew it from a $300,000 practice to 1,500,000, and it was along the way every ounce of determination and, struggle and time, and you watch it grow, and now all of a sudden to realize that you've gotta give it up. It changes the way you look at things, but
mm.
Along that way too, when I stopped by Erin's place on my way coming home from Montana the other day, she stopped and asked me if I miss private practice dentistry. And at first I was like, I don't know. It's kind of yes and no. Well, I figured out yes and no. I definitely miss the dentist I was 10 years ago.
Mhm.
But no, I do not miss that dentist that I was for the last 5 years in private practice. And I'm glad that's moved on, and I'm getting away from that idea of it being my identity. And my identity now is just I'm a strong person for my family.
Mm.
I will say that Craig is one of my favorite dentists out there in the dental world, but he also happens to be one of my favorite humans.
Mhm.
And when he said he was a dentist that was part of the community, he was a lot more than that. He's not gonna tell you, but he is a sportscaster. He would do all of the high school basketball games for the radio, and I think really a big part of the community. Plus, he was entertainment for the community because he would post security camera footage of his dumpster behind his office and all the weirdos that came looking. It was entertainment.
I'll miss those fun. Jason, yeah, we had on video a takedown of a potential robber with the local police as they arrested him on the spot and we had it on security cameras. It was fairly entertaining.
Yeah, it sounds like, you might wanna start selling some of that
Yeah,
footage. Yeah.
yes, we could
And
use
that's
it.
supplemental income. Yeah.
Needed a better YouTube page for it.
Yeah, yeah. So, you mentioned earlier, Erin and myself and everyone listening knows these dentists that half-ass it or quarter-ass it when it comes to sleep in particular. Um, so now you're all in on sleep. It's, shifted, not just with your diagnosis and the sale of your practice, but also the focus of your career now in dentistry is on sleep. So what how is that different? The workload, the schedule, the stress, the strain, physically, mentally, otherwise. Um, give me the pros and
Yeah.
cons.
Well, I don't know if it's a pro or a con, but I hadn't worked for anybody else for 30 years other than working for my patients basically. So to go from that into, and I had a rotating schedule. I worked 3 10-hour days, but it rotated throughout the week. And so that was nice. I kind of set that, and you can take any time off when you want. Now to be in a bit of a corporate structure, that is, Kent. Kent is a man of systems, and it's a well-oiled machine. Uh,
Yes.
and so, to be in that environment is very different from uh, I might look at the schedule the night before, when I was in private practice, say, "Oh yeah, we got that, no big deal." And my team would come to me on occasion and I'd say, "Oh yeah, go fix that." Whatever.
Mhm.
We're never the system and the way that I was a half-assed dentist who actually was pretty dang good at it, but that was because I had enough experience to do it.
Sure.
Trying to do that in sleep medicine, where there's a whole nother other realm with, the insurance and, all the details, there are so many parts that have to work well in unison that I don't know how Erin does it in a smaller practice like that, because when I see it, from, Star Sleep and Wellness view, it's a whole different animal than I've ever been a part of, but I'm enjoying the heck out of that, because it's such a new challenge.
Do you think
Sure.
I mean, you really didn't have to figure out the business part, and you just get to be the clinician, and
Yeah,
what do you
yes, and there's a little bit there, we still have to be a part of that whole process and take ownership of how the success of the business goes. And maybe that's one of the cool things is there's 5 of us dentists in the group now. There were 2 before me, and I was the 3rd, and then we quickly added a few more. Um, we have such a great group because all of us have been in private practice, and all of us understand what it takes to manage people and to run a business. And so we do our best to make sure that our side of it is taken care of, and they don't have to worry about it.
Mhm.
Oh, and to connect with patients, which I'm
Oh
sure
yeah.
you're very good at, and now
Yeah.
you have to maybe that's a question Jason has for you, but now you have to do it over technology.
Yes, yes, that's a big switch to go, be facing knee to knee with someone and mimicking their behavior and talking with patients on a daily basis. We all get really good at that, and I'd like to think that I was excellent at it. Now doing that through a computer screen, where a third of the time they can't even put their video up on it, so I don't see them.
Yeah.
They are nervous as can be. They don't know what they're really gonna be, looking at.
Yeah.
An expectation that I sat in a chair with not too long ago again, and wondering what is the hammer gonna drop on me? And,
Mm.
they don't know what's coming for sure. So, it's tricky. And then there's the weird ones that, gal who, she she couldn't believe that she might have sleep apnea or that her lungs might not be working well. And as she smoked 2 cigarettes during the online consult, that was a new one for me.
Good old
Well,
Texas.
Yep, yep. No teeth,
yeah.
2 cigarettes. That's all we need.
Yeah. You're set. You're set. But give me that and a urinal and whew, good night, folks.
Yep, yep. And a
Yeah.
few moose running through the backyard. We're good.
Yeah. With sleep, I mean, you mentioned earlier, you alluded to something about having to learn a lot. So, I mean, what are you finding most challenging about this phase of your career?
Um, for me so far, I feel like kind of a detective in, every day we chart prep for the patients we're going to see the next day. And
Uh-huh.
my glimpse into it is, okay, they had an exam with one of the physician's assistants or one of the sleep physicians. And then I got to look at their sleep study and try and make out why is this person got an AHI of 5, yet they've got, as minimum or a baseline O2 of 90. What the heck's
Uh,
going on with this patient? Well, that's the cigarette smoker. We've
huh.
got so it's a constant thing. And, one of the interesting things for me as a person with Parkinson's disease is that I also suffer from REM sleep behavior disorder.
Uh-huh.
And so I'm starting to see, and they kind of kick in my way, some of these patients that are having issues with that.
Mm.
Huh.
And so it's been, again, another path I'm getting interested in and learning more about. So it's all new challenges that is really at 56 years old. It's kind of nice to have those new challenges in your life rather than just sitting around and playing golf.
Yeah, sure. Sure.
I love golf.
Golf's overrated though.
Yep. Pickleball. That's where I got to go, apparently.
Yeah,
Yeah,
apparently that's
well,
all the
you're a
rage.
fisherman,
Yes.
and he
That
loves
is,
his dogs,
yes.
hunting bird dogs.
You're gonna have to, come to one of the hunt tests when, they're in your area. Come check out what I do.
For sure.
So how with your diagnosis, um, how do you manage the um the uncertainty of certainty or the certainty of uncertainty? I think you interpret that how you will.
Yeah.
How do you process that, and how do you um, move through each day with that?
Well, it's kinda like I mentioned early, the first things at first, I was very, selfish about it, and then
Yeah.
I the panic button, and then I kinda changed my thoughts patterns on it. Now, one of the downsides that with anybody when you start finding out you might have something is you get too involved in Facebook groups and all of that. My doctor told me right away, "Don't look at any of that stuff," and of
Yeah.
course I did, but now I understand why, because so much of that is just, a emotional trap, and I avoid that like the plague now.
Mhm.
I try to find the things that, keep me happy. Erin referred to my dogs. I've got 2 labs, and we do hunt tests around the Pacific Northwest. And so each day I'm working with them training, and I'm working with a buddy, and we've got training days. And then after work on about 2 to 3 days a week, now I'm going fishing at the local
Mhm.
river. It's those times though where I get to just walk and be with myself and process my thoughts on how I'm feeling about the progress. Um, you know, Every patient who's got Parkinson's will tell you they've got on days and off days, or on times and off times. And for
Sure.
me, that's about 6 days of on time and one day that really sucks bad.
Mm-hmm.
And I always hope that that's not a day where I've got to be doing something important for somebody else. And that was a huge stress when it was in private practice,
Mm-hmm.
because that day fell on. I only canceled one day, but it was a day where I had to walk away,
Mm-hmm.
and I knew that I didn't have much longer to go and be able to do it.
Mm-hmm.
Uh, I don't know if I answered that question very well, Jason, but I think you have to find the time for yourself, to really do what you love, which for me is hiking into a fishing spot. And the best thing you can say is that it's not about the fishing; it's the places that the fishing takes you to.
Mm-hmm.
And that's the part that I enjoy, and it gives me that brain dump, to be able to talk to myself and be one with nature, and however you wanna be that, that's my enjoyment.
Yeah. Look, what a, do you, um, what would you say to someone that doesn't have any sort of diagnosis that kind of directs manages the direction of their career to an extent, but that is 56 years old? What would you say to a 56-year-old dentist about maybe crafting a schedule, crafting a career that allows them to do more of what you're saying? Like, why wait until you have some sort of health diagnosis that maybe precludes you from doing some things, um, to do the things that really bring you the most joy? Why not intentionally design that life?
Yeah.
Does that
I
make any sense? What I'm getting
it
at?
does, and it's something I've kind of thought about a bit,
Uh-huh.
uh, in that, I was the person who, like most of us, who thought that would never happen to me. And that's all of us, or not all of us, but you're either on completely one side and you're afraid that crap's gonna happen to you at all times,
Mhm.
Yeah.
or you're the person like me and most of us who think that's never gonna happen to me, that happens to other people.
Hmm.
But you can't be that way when it comes to the financial side for yourself, and for those who depend on you. And so you need to set things up in case that does happen. And one thing I've realized, as I started, trying to sell my practice, I always figured, well, I'll ramp up down the road for a while, but for now, I'm going to just do this thing and whatever. Always have your practice ready to sell, meaning always have the best business systems you can put in place. Always keep your equipment up to date. Always have your team trained and the best group that you can have in there, so that that happens and your spouse has to turn around and sell the practice. Don't hurt them by having a crappy rundown office that someday I'm gonna get back to building up.
Mm-hmm.
I think that, the other side of it is live for today. And I don't mean to go out and squander everything, but don't wait for retirement to take the trips.
Mm-hmm.
Don't wait for retirement to start writing that book that you had an idea about.
Mm-hmm.
Do that now. Do those things that help you release, the pent up stress that we get, and especially in private practice. Um, I just think there's so many things where, go out and coach your kids, take them on those trips to Disneyland, get them out of school, do the fun things
Yeah.
while you can. It's always gonna be back there. The practice will be there, those things, but at some point in time, I'm not gonna be able to walk to the places that I want to. So right now, I want to be able to explore the places I haven't been. I want to take my wife on the trips that we always talked about going. We're gonna stay in that hut over the water in Tahiti. We're gonna do those things, now rather than wait until we're 65.
Yeah.
So,
Do
yeah.
you can I ask if you have disability insurance?
Nope, I screwed that up. When I was
Mhm.
45, they raised my rates, and so I dropped it, figuring, I'm not that guy. That's not gonna happen."
Mhm.
Also,
I
when
know,
I
it is hard
Yep,
to
that's a
send
big
that
chunk
check
for
in.
disability
Yeah.
insurance. I thought, I've been wasting my money on that." Yeah, now it would help for sure. Um, the other thing was, long-term care insurance. My parents have had it for a long time, and I talked to them, and my mom said, "Well, we started getting it at 60." So that was kinda my thought. Yeah, when I've turned 60, I'll start getting the long-term care insurance. Well, now I can't get it. They turned me down for that. So Yeah. So start making those plans that, again, are the safety net. Get them in place so then you don't stress over them down the road. Get the will in place, all those little things. But then live for today. Don't just wait for retirement.
Hmm. Hmm. Yeah, I appreciate what you said. Well, I appreciate everything that you just shared. But one of the things that I really uh, is resonant is to, sort of always be prepared. When you're talking about having the practice always ready for sale, and the team always properly trained and the equipment always updated. Um, we tend to, it's part of the human condition. We're often motivated just by pain, and then we'll do the thing,
Yeah,
and it's usually too late then, right? Um, so yeah, just to don't wait until you have a heart attack to start trying to lose some weight and get in shape.
okay.
Be
Yeah,
in shape, stay
that was
ready
one
for battle.
that was one of those things I was gonna throw in there. If as far as advice, exercise, start now. And I say that with the idea that no matter what disability or limit that you get diagnosed with, whether it's cancer, ALS, Parkinson's, whatever it is, if you are healthy going into that, if you've been lifting weights, if you've been getting your cardio to a decent level, you're gonna have a better chance of surviving or at least extending your good quality of life. And that's where I'm at now. The thing about Parkinson's is it really steals your balance and your ability to walk well. And so I'm trying to outdo that and beat that race for as long as I can by doing my squats, doing my little boxing things that help you out with your hand-eye coordination, all those little things that will help extend the career or life of me being in uh, good movement, being able to enjoy it, rather than that end of life that's gonna be horrible with Parkinson's.
Hmm.
Parkinson's is a shitty disease when it comes down to the end scale of it, and so that scares me, but knowing that, okay, I have that option of pushing my health and exercise and working out, that will extend my good time, my on time, and so
Hmm.
that's my goal now. I want it to be decades before I can't walk to those places.
Sure, sure. Well, Craig, I want to say thank you for sharing so openly today. So often when Erin and I have guests on Sleep Matters, um, it's fairly lighthearted, or they're hawking some, product or whatever it might be. And this is probably the realest conversation we've had. And um, your bravery and courage and sharing so openly is is so appreciated. Um, when you shared that you told your wife to, stay home when you went and received your diagnosis, my wife about 6 months ago was diagnosed with breast cancer, and when she went for her appointment, I was, I'll go with you, of course. And she said, "Oh no, it's no big deal. It's nothing."
Yeah,
And that wasn't the case. And then she had to, drive home by herself, 45 minutes.
yeah,
Um, and it was probably the longest 45 minutes of her life. And just you sharing that, somebody hearing that, and if they've got one of these types of appointments coming up, they'll bring their spouse, they'll bring their significant other, they'll bring a friend, and even that alone
yeah.
is worth the cost of admission to this episode. So, I mean, really, just keep keep doing what you need to do, and your message of strength, your message of hope, your message that it's not all roses. You went through sort of those stages of, what about me? Woe is me, and what about everybody else? And then kind of being pissed and then resilient. I think that's, look, that's human. That's real. And I'm so thankful you shared it with us. Truly.
Well, I appreciate that, and I'm again sorry to hear about your wife's diagnosis, and that definitely hits home in that idea of that's a difficult moment. And one of the things that I've found through this is that you need to allow people in.
Mm.
Very
Mhm.
much, I'm a person who doesn't want help, but your good friends want to be there for you. Don't push them away. Let them know you're okay, but you can also use their help sometimes.
It's not a burden. People want to help.
I know
Yeah.
you'll be there, and anytime I need you.
Yeah.
Yeah.
And I
And
got
I'll
a
tell you what,
urinal waiting for you if you
I was gonna say,
need
I'll tell
me.
you what, Craig, you're the only guy that I'll share a urinal with. We we could just chat away. We could host an episode at the urinal, my friend.
All
Me
right,
and you.
so I got a story I gotta tell you.
All right, lay it on me.
I was in Las Vegas about 2 AM in the MGM Grand, and I gotta use the urinal, so I go to the bathroom, and in there is Norm Macdonald by himself using the urinal 3 down, and I look at him, and he looks at me, he says, "Rules still apply, we don't talk." So we got our job done, we washed our hands, then he shook my hand and said hi, and that was it, but yeah, there's
Oh,
you're
that's
welcome, and have a
fantastic.
great night, Jason, so
Oh, I love it. I love it. So, uh, I'm glad you brought that to a not
A
only a full
lighthearted
circle with the
moment.
urinal, but a lighthearted moment. So we play a little game in
alright,
closing out. Okay, it's called the final countdown. Are you ready?
I think so, hopefully.
So we're going to ask you a few questions, and you've got to answer them lightning round. Okay. All right. Number one. Dream job. Money doesn't matter. What would it be?
I'd be a high school basketball coach.
Ooh.
Always
Have you ever
wanted
been? Go ahead.
I just always wanted to do that or be the UCLA head basketball coach was my real goal.
All right. And have you ever been fired from a job?
Yes, my first associateship I was.
Okay. Give us the 20-second synopsis.
He had too many associates and only one practice, and so somebody had to go, and I was the guy who would talk back to him, and so I got fired.
Oh man, I was hoping it was going to be something like you were stealing Explorers or something like that.
A month later, I was living in my own office, so it was pretty good.
All right. And then, do you believe in ghosts?
No.
Do you like tapioca?
Yes.
You're going to enter the ring for the battle royale. What's your theme song?
Ooh, well, if anybody knows me and I have a drop of alcohol in my system, they know I love me an Axl Rose dance. So welcome to the jungle.
We've got fun and games.
That was a good lightning
Yeah.
Egg.
Craig Harder, thank you for being here. Thank you for being part of this show, being part of our lives, and for sharing so openly. I'm thrilled to know you, my friend.
I'm glad you're on on the sleep train now.
Yes, now I'm stuck.
In time.
Real, so good to be part of it. And Jason, we'll make it up to Erin's place. I'll come and we'll chat then. All right.
We'll make that happen.
Okay.
All right, my friend. Take care.
Sleep matters.